Okay, so does everybody feel good about the Neer's impingement? I already did that one, but we're gonna put that arm into pronation, or internal rotation technically at the shoulder. We're gonna brace here, and then passively flex, okay? What's a positive sign? Pain, up here. What could it potentially indicate? There's two things.
AC joint impingement.
There's one thing, yeah. Subacromial impingement.
Or AC joint dysfunction.
On the side.
Yeah.
I couldn't remember if that was Hawkins.
Yeah.
AC
Maybe
joint
it's probably it's
dysfunction
both.
and
Actually.
surgical.
Okay, so yeah, AC dysfunction, so like a separated shoulder, or subacromial impingement.
Hawkins impingement sign.
Hawkins impingement test. Arm flexed up, shoulder flexed up to 90 degrees, elbow flexed to 90 degrees. Internally rotate. Again, looking for pain up here. And then we're looking at subacromial impingement.
Empty can test.
Empty can test. So we saw that one as well. So we're going to instruct the patient to flex the shoulder to 90 degrees, and then abduct by about 30 degrees. Turn the thumbs down, and just resist as I push. Okay. And what's a positive test?
Supraspinatus.
Well,
Weakness.
yeah. What indicates a positive test?
Pain or weakness.
Pain or weakness. Okay. Especially weakness. You're looking for that full thickness tear of the.
Supraspinatus.
Fantastic. What else?
External rotation resistance test.
Okay, so we're gonna have the patient get in the robot stance, okay? I just want you to rotate out towards my hands and you're gonna provide resistance. Good. What's a positive test? Weakness, okay? So this is, any of these resistance tests, we're testing strength or weakness, whichever side of the coin you want. And what are we testing?
Infraspinatus.
Infraspinatus, right? That's our primary external rotator.
Would they also have pain?
So again, it depends on if it's fully ruptured or it's partially ruptured or strained. Okay? Strained partial rupture would be pain, whereas if they just literally physically could not move their arm out, now we're talking about weakness and full rupture. Yeah.
Drop arm test.
Drop arm test, okay? This one's super easy. We're just gonna passively abduct the arm, and when I let go, I just want you to lower it slowly to your waist, okay? Boom. Now, if she can't lower it slowly, dang it, now I'm giving you the answers. Okay, that's a positive test. If it drops, it's a positive test. What would a positive test indicate?
Full test.
Full tear of supraspinatus, maybe even infraspinatus, okay? But supraspinatus is our primary abductor. Well, up to a certain point. What's next?
Fallon and Tinel test.
Fallon and Tinel's sign. So I did Tinel's already. It's that tapping over the carpal tunnel. And what's a positive test? What's indicative of a positive test? Numbness, tingling, shooties down into the finger. And what would it indicate? Carpal tunnel. Okay. And Phelan test, we're going to have the patient put dorsal aspects of the hands together and flex at the wrist and have them hold it technically for a minute, okay, but you're not going to take that long during the exam. And what would a positive test, what indicates a positive test? Numbness, tingling in the affected side or sides. And what would it be indicative of? Carpal tunnel. Okay.
Bulge sign.
Bulge sign. All right. This is going to be a little hard to see because obviously she.
They're not.
Nah, that's not going to work. It's fine. Okay, so bulge sign. We're going to take the hand that is most caudal, okay, so most proximal to the hip, and we're going to take it and we're going to push distally towards the patella, so kind of compressing that suprapatellar bursa. Press distally. Take the index finger of that same hand and press on the medial infrapatellar space. And we're looking for a bulge in the lateral infrapatellar space, and we can even tap that and feel for a fluid wave. And what would that indicate?
Diffusion.
Diffusion, right? Okay.
Balloon sign.
Balloon sign, very similar to the bulge sign. We're going to compress that suprapatellar bursa distally. Okay, so we're pushing down and distal. And then we're gonna take our thumb and forefinger and we're gonna smush that those infrapatellar spaces. Got bumpy knees. Okay, we're gonna squish those. And what would a positive sign be? This is balloon sign, we're looking for balloon sign. Yeah, the patella raises up towards the ceiling, right? And what would that indicate? Effusion. Okay, next one.
Valgus and varus stress test.
Valgus and varus stress test, okay? So for this one, again, I personally liked, because most of my knee exam is gonna be seated anyway, so I like doing it there, but you can also do it here. So, in the affected knee, we're gonna raise it up. I like to do one pass with the knee fully extended. If we're doing valgus stress, we're gonna take our left hand, put it on the lateral aspect, and we're gonna push medially on the knee and pull laterally on the ankle. And we're applying stress to the medial aspect of the knee, checking for what? Medial collateral ligament. What would a positive test indicate? Or what is considered a positive test? Pain or laxity, okay? And also, so we've done one extended. I also like to flex to about 30 degrees and again do that same movement. So that's valgus. With varus, same thing. Or maybe scoot that way. But opposite, okay? Extended, we're gonna push on the medial aspect of the knee and pull on the lateral aspect of the ankle. Applying stress to the lateral aspect of the knee, testing for what? Lateral collateral ligament, and what indicates a positive test? Pain or laxity, okay? So straight, flexed, and do the same thing, okay?
Anterior posterior drawer.
Anterior posterior drawer, okay? So this is one where, maybe scoot forward just ever so slightly. Okay, go ahead and lie down. So this is one I like to sit on them, okay? So anterior drawer, we're gonna sit on the foot. We're gonna wrap both hands around to the popliteal space, and we're gonna tug forward. Give it some good jerks forward. And what is a positive test for this? Laxity. So if we have that no firm endpoint, that tibia wants to keep moving forward, okay? What would that indicate? ACL, great.
Would you have pain if it's like a partial ACL
Yeah.
through that?
Yep. And then a posterior drawer test is similar, but this time you're applying pressure posteriorly. So you're just pushing back toward the patient. And a positive test would be laxity, okay, that tibia moves posteriorly more than you would expect. And then what would that indicate?
PCL.
PCL tear, okay?
Lockman.
Lockman, again, same thing, we're testing for an anterior cruciate ligament tear. You're gonna grab here on the thigh and then wrap your other hand around posteriorly, and you're gonna ideally put your thumb here on the tibial tuberosity, and you're gonna pull forward like that, okay? And what is a positive test? Laxity, okay, and like I said, indicates a ACL tear. Alternatively, the other option that was mentioned, you want to stabilize here. You can grab like this and pull. That gives you a little bit more leverage, okay? Or, like I said, just do the anterior drawer. Not in a test, but in real life.
Last one, McMurray.
Last one's McMurray, okay. So again, we want to bring the knee up into flexion and internally rotate. And if I'm internally rotating, which side of the joint, the knee joint, should I be feeling? Lateral, right? So lateral, we're feeling for any, what? Pops, clicks, pain, okay? In that lateral joint compartment as we extend out. Now, if you can, it's not terribly hard, it just takes some finesse to apply a little bit of valgus stress, okay? And what that does, it kind of compresses that joint, that lateral aspect of the joint a little bit, ideally, trying to catch on those flaps of the meniscus. So then we rotate externally. What are we testing if we rotate externally? Medial meniscus, so we want our fingers either over the top or underneath to be on that medial joint line. And we're gonna rotate and we're gonna extend out. Again, feeling for any clicks, pops, pain. And that would indicate torn menisci. Okay, that was the last one.
Yep.
Okay, you guys feel good about those special tests? Okay. All right, so